Hey, thanks for joining me on this video. A shout out to frontline healthcare workers. Subtitle, Is Your Workplace Worse Than Hell? And we have a special treat in this video. We have patient Bob coming up. Thanks so much. My name is George Dresser. I'm an internist. I do general internal medicine and I do some clinical pharmacology as well. I work on an internal medicine inpatient ward about 25% of the time. And this video is really based on my thoughts about my time when I'm doing that work. This video is for anyone who thinks that their workplace is hell, because after watching this, you're going to be rethinking some of the things that you might want to be grateful for. This video is for frontline workers, whether in a hospital setting or nursing home setting, because sometimes it's good to sit back and reflect on what you do and the real value in what you're doing. If you take a step back and say, what makes for a good workplace? I think that a good workplace it gives you the ability to live out a purposeful existence. I think one of the things that's been shown to really relate to job satisfaction is the ability to determine your own workflow. I think having a good boss that enables you to be purposeful and successful in having this meaningful work is important. I think having good colleagues that are all pulling in the same direction as you is very important, to have a group dynamic that is helpful. And I think what I really want you to think about is that having good clients reminds you of why you are doing what you are doing. And it's really the work itself, the clients, that give you enough meaning so that you get up in the morning, you put your feet on the floor, and you get to work. So I think those are the things that we really need in a great workplace. I want you also to stop and think about what defines suffering. I think if you think of all the things that you might define suffering as, it would be captivity, slavery, famine, violence, poverty, lack of self-determination are all the things that sort of define suffering. One of the core concepts is certainly in the Western world is the right of self-determination. And I think as you'll see, the clients that we serve have really lost that. When we start talking ethics in Western medicine, we always end up landing on autonomy as the most important ethical principle. And this again is something that our clients, our patients, often end up losing. When I think about the patients that I tend to care for, they are elderly individuals. They're admitted to hospital setting with a disease process such as organ failure or infection. They often have delirium, which affects their ability to think clearly. But interestingly, delirium does not blunt your ability to suffer in the moment. Many patients after hospitalization will say, I don't remember very much, and that's a very good thing. But my experience of my workplace is that our patients, whether they are delirious or not, suffer about the same. One of my favorite questions when I first start on a medical team, I kind of take over the team from whoever the previous consultant staff was. I ask the house staff, do the patients know why they are here? I get blank looks from the residents often. I've actually done this before where I've written on one column on a sheet of paper the reason that the medical team is keeping a patient in hospital. And then on the second column, I go around and I ask the patient why they think that they are in the hospital. And I can tell you that there's only about a 20% concordance rate between what the patient is thinking and what the medical team, the healthcare team, is thinking. The bottom line is that patients don't even know why they're in hospital. You might call this the HEL index. If you were to graph, delirium on one axis of a graph and helplessness on another axis of this graph, the bottom line is that the patients obviously with the most delirium and the most helpless are most in HEL. The ones who have the least amount of helplessness are able to do things for themselves, and the least amount of delirium perhaps, are farthest away from that. But this is the kind of picture that we end up living with when we're working in the acute medical setting or in long-term care. I want to illustrate for you a typical conversation I would have, and the patient that has agreed to help me with this is Bob. Let's just take a look at this interview that I did with Bob, and we'll go from there. I wanted to be able to show you a typical conversation that I would have with patients, often when I'm first starting on the medical team, to illustrate what I'm talking about. This would be a very typical example of the kind of conversation that I have. Bob is not at the far end in terms of the types of patients we see. Bob, I would say, is probably about the average patient on the internal medicine ward.
Okay, first of all, Bob, I really want to thank you for agreeing to talk to me today. I know when you're not feeling well.
Hey, man, no problem. Like, what else do I have to do around here, man?
Do you know where you are staying? What this building is that you're in?
No, I don't know where I am.
Okay, well, do you know why you came here in the first place? What brought you here?
I can't remember, man.
Okay, well, do you know how long you've been here?
You know what? I'm not sure. I don't know how long.
What are we doing for you here at the hospital, Bob?
Yeah, that's a great question. Every day it's different. Most of the time I'm not allowed to eat, and when I am, the food is terrible, man. People come into my room, they stick needles into my arm, they drain blood out. Sometimes they put these plastic tubes down my nose and they push real hard into my stomach. Sometimes they go up the other way into the bladder. Sometimes there's blood coming from my nose. Sometimes there's blood in my urine. You know, the worst part of this is I never know when they're gonna come. It's like out of the blue, man. You're sleeping, bam.
Bob, I'm really sorry. How long do you have to stay here?
That's a great question. I don't know, man. Is this hell?
Okay, final question, Bob. Where are your friends and family in all of this?
Dude, they told me there was this pandemic thing, man. They're not allowed to come. I'm here alone, man.
Okay, so I hope you enjoyed that. This example is not the exception. This is the rule for many of the patients that I interact with, and certainly many healthcare providers that work at the front line. This is the kind of interaction that they would have. Imagine if you are that nurse that has to go in and phlebotomize a patient at 3 o'clock in the morning, because that's when you have to do it in order to have the results up by the time the medical team is rounding at 8 a.m. You live this, and as part of that team, we don't want to create suffering, and yet because of the things that are necessary, this is often the consequence. And this is what you go home at the end of your day feeling like, that you're a part of this suffering for many of these patients. Compare this example to some of the other reasons that people would suffer. Let's think about, death row. Well, at least when you're on death row, most of the time you know why you're there. Let's think about jail. At least when you go to jail, you have an idea of the length of time that you're going to be there. Famine. at least when you're in the context of a famine, you know why you're not being fed. Okay, what about dying on Mount Everest? Well, at least you can remember how you got there. If you want to complain about the environment in which you work, at least you've got nothing on the acute medicine ward. Finally, I would like to just remind you that if you work in acute medicine or even in long-term care, your patients suffer more than anyone on the planet. If you work on the front lines of this kind of medicine, then you have the privilege to step into the suffering that our patients are experiencing. And while you do have to brace yourself to deal with that suffering, it's a real privilege to have the opportunity to ease suffering for many of these very, very vulnerable people. When you see captivity, slavery, famine, violence, poverty around you, remember that your workplace is unique, and do what you can to ease the suffering of those around you. Thanks so much for watching this video. I hope you enjoyed it. If you like this and you want to see more like this, please like the video, subscribe to the channel, and you'll be notified when I post more content. Thanks so much. Have a great day.